Zelnetta. This is nursing 215 advanced med surge. Today I'm going to perform a central venous dressing change along with assessments and flushing the lines. Currently, the patient is not on any IV fluid at this time, and so we have to make sure that the line remains patent. I have checked the patient's orders. I have checked the patient for allergies. The orders state that she has to have the dressing changed today. We have a setup set up on her bedside table of the transparent dressing, the antimicrobial wipes, the chloroprep per my patient hospital's policy, two 10 cc saline flushes, along with, as ordered by the doctor, 2 mLs, two 2 ml syringes with heparin to keep the line paper, sterile gloves, clean gloves, my PPE, which consists of a mask and clean gloves, my trash bag, and we're going to maintain privacy for the patient, close the doors, and pull the curtain. Next is the introduction. Hello, my name is Zelnetta. I'm here to do your catheter dressing change. Okay? The patient has agreed to do the dressing. I'm going to put her in a position to have her head turned to the side to access the catheter better. I'm going to sanitize my hands, apply my PPE to my mask and gloves, open the packaging for my saline flush and my heparin flush. I'm going to inspect the dressing, inspect it by gently palpating, making sure not to go exactly on the insertion site, checking for any pain, redness, swelling, or any drainage. Patient doesn't have any drainage or swelling. Ma'am, do you have any pain? She expressed that she doesn't have any pain at this time. Okay. The next thing I'm going to do, I'm going to gently remove the dressing, starting from the top, working my way down to the bottom, making sure that I move it slowly and gently so I do not disrupt the CVC insertion site. We do not want to pull these lines. The patient has two sutures holding in CVC that are attached. I'm going to throw away my old dressing. Now I'm going to change my gloves, take my gloves off, sanitize my hands once again. Now I'm going to don on my sterile gloves. Open my package, goes in the gloves. I'm left-handed, so I'm going to use my right hand and put on the left glove while pinching the inside cuff so I can maintain sterility. Then I'm going to take my fingers, place them underneath because my hand is sterile now, and then put on the right glove. Once I have the gloves in place, I'm going to take my chloroprep wipes in a circular motion, clean around the catheter, removing any debris that's noted. I'm going to do that twice in a circular motion, slow circular motion. Toss that away. I'm going to let that dry for 2 minutes or shorter. It all depends on how soon the skin will be dry. I'm going to take apply some skin protector, making sure, tapping it, making sure not to disrupt or put it at the insertion site because these dressings can be really tight on the skin and so we don't want her to have any damage. So after all that is complete, I'm going to apply the transparent dressing over the catheter site. Normally, I will remove the paper on the outside, but for purposes today, for easier removal, I'm going to leave it on. Next thing I'm going to do, I'm going to take my antimicrobial wipes along with my 10 cc syringe of normal saline. I'm expecting that the clamps are applied. I'm going to remove each catheter cap one at a time and clean the site vigorously, removing any debris. My clamps are still in place. I'm going to take my syringe and put it in place. Once I put it in place, I'm going to unclamp the line. I'm going to pull back slightly and slowly to get a blood return. Once I have that blood return, I'm going to, over 1 minute, insert 10 cc's of normal saline to flush the line. Once I've done that, I'm going to clamp my lines back, wipe the ends once again, take my 2 mLs of heparin per doctor's order. I'm going to apply it to the end, unclamp my line, and insert it slowly. This is to maintain patency of the catheter. I'm going to clamp the catheter line, apply my microbial wipe, and place a new cap at the end of the line. I'm going to repeat the same process on the other side, the other line. I'm going to take my new antimicrobial wipe. I'm going to wipe vigorously, removing any residue. Take my, meanwhile, the line is still clamped. I'm going to place my 10 cc flush at the end of the line. We open the clamp, pull back slightly and slowly. See the blood return, and then slowly insert the saline into the catheter over 1 minute. Once that's complete, I'm going to clamp my line, remove the saline flush, clean my line again, end of the line again. I'm going to take my heparin flush, place it at the end of the catheter site, slowly inject 2 mLs of heparin. Press order. My line is unclamped, and I'm injecting the heparin. Heparin has been sealed. I'm going to clamp my line once again, clean my lines with the antimicrobial wipe, apply the heparin cap, inspect everything and make sure everything is the way it's supposed to be. The lines are tapped. I've inserted my heparin to maintain patency. I'm going to write on the sites, the date, the time, my initials. In the chart, I'm going to put the dates that the dressing was changed and the time, along with how the patient tolerated the dressing. Patient tolerated the dressing with. Going to remove the patient's mask, place her back in a comfortable position, gather my equipment that I've used, remove the trash bag, remove my gloves, remove my mask, Apply hand sanitizer. I braced my bed at the very beginning for a workable site. We're going to return the bed to the safe position for the patient. I'm going to let the patient know that the dresser has been changed yet and ask her, are you having any pain? Patient states no. Put her call light within reach. Just call me, press the button if you need anything. And thank the patient and dispose of my equipment in the proper receptacle. And once again, I did document everything that I did. The patient already treated well. Thank you.